Melatonin. Melatonin is a well-known hormone in the body and in all organisms that is released from the pineal gland located near the center of the brain. Melatonin assists with rhythmic cycles, such as our sleep cycles. Melatonin is produced and influenced by the retina of the eyes, and when light and dark is recognized. If it is dark, for instance, the eyes are closed preparing for sleep, so melatonin will be released. The students and faculty at Yale University School of Medicine gave the substance its name on the basis of its ability to lighten skin color in frogs by reversing the skin darkening effects of melanocyte-stimulating hormone. Melatonin is primarily used as a sleep promoter and regulator, but more recently it is found to have effects on the neurodegenerative diseases such as Alzheimer's. More specifically, how it can assist in helping slow the rapid progression. In this presentation, we'll be reviewing melatonin as a complementary alternative medicine.
Many people take melatonin as a helpful sleep agent. It is not only produced in the pineal gland of the brain, but it is also found in areas such as the eyes, bone marrow, and in the gut. Melatonin helps you to fall asleep easier, and the people who use melatonin regularly are the people that struggle with insomnia and have jet lag. But evidence shows that melatonin is a powerful antioxidant. According to Healthline, it also helps support eye health, treats stomach ulcers and heartburn, ease tinnitus symptoms, and even raise growth hormone levels in men. Children with autism may have abnormal melatonin levels and might take some to help improve sleep duration. As people age, their melatonin levels decrease, but people with Alzheimer's, their levels decrease more significantly. Taking melatonin helps to slow the cognitive decline associated with Alzheimer's.
Medication information.
Melatonin is a dietary supplement meant to treat general sleeplessness as it is unregulated and non-selective for all three melatonin receptors. While it is meant to treat sleep problems, it hasn't been tested extensively and only effectively treats specific sleep-wake cycle disorders. Like other complementary and alternative medicine, melatonin does have FDA-approved prescription counterparts which have been proven to treat the same disorders that melatonin does, usually more effectively or particularly. Ward, 2006.
Those wishing to take melatonin as a complementary alternative medicine can have it administered orally or intravenously. After oral administration, the melatonin shows poor absolute bioavailability from either poor oral absorption, a large first-pass metabolism, or in some cases a combination of both. After intravenous administration, the hepatic metabolism is less important due to the absence of the hepatic first-pass effect. The cytochrome P450 enzyme, CYP-IA2, causes the melatonin to undergo hydroxylation to 6-OH melatonin. Finally, 70% of melatonin is excreted from the kidneys as sulfate, while 6% is excreted as glucuronate conjugates. Less than 1% of melatonin circulating in the bloodstream is unchanged before being excreted into the urine.
Melatonin plays an important role in regulating our sleep cycle. It's synthesized by the amino acid tryptophan and produced in the pineal gland, which is under the suprachiasmatic nucleus's control, or the SCN. The SCN receives input from the retinas about light and darkness from the surroundings. After being produced, melatonin travels into the bloodstream and is transported to different tissues of the body that contain melatonin receptors. These receptors detect when the level of melatonin is at the highest, or when it's dark, and signals the body that it's time for bed by inducing drowsiness and lowering the body temperature.
When it comes to the contraindications and precautions of melatonin, there aren't many. Melatonin has one contraindication, and that is the concurrent use of immunosuppressive treatments. It is recommended that those with certain autoimmune disorders not take melatonin because the melatonin may weaken the effects of the immunosuppressants and then in return cause negative effects. It is advised to not take melatonin if you are pregnant, lactating, under the age of 20, or if you have depression, hypertension, a seizure disorder, and/or an impaired liver function.
Melatonin is a generally safe alternative medicine with a few minor adverse effects, which most users do not experience. For individuals who do experience adverse effects, they do not last long and are easily managed. The most common adverse effects are fatigue, mood changes,
difficulty with certain motor skills and cognition, mostly due to excessive sleepiness. Less common adverse effects include an increase or decrease in both heart rate and blood pressure, and decreased metabolism of glucose, leading to higher blood glucose levels. The most effective way to manage or avoid adverse effects of melatonin is dosing the medication along the same schedule as normal human circadian rhythms. This means that individuals should take melatonin right before bed in order to avoid being fatigued and excessively sleepy. Melatonin should not be taken before performing activities that require a high level of alertness. Daytime dosing should be avoided because extreme drowsiness can occur and inhibit an individual's ability to perform their daily tasks. Caution should be taken when combining melatonin with other sedatives, as the combination can have an additive effect and increase the risks for more serious adverse effects. Any drug interaction should also be taken into consideration, especially for individuals taking antihypertensive medication in order to reduce the risk of these adverse effects. Although the adverse effects of melatonin are limited, individuals should always be cautious of any supplements and medications they are taking.
There aren't many drugs or foods that seriously interact with melatonin. The biggest medication to worry about is sodium oxybate. This drug is not okay to take with melatonin because it affects the central nervous system and may cause an increase in the severity of the side effects. These side effects include excessive sedation, confusion, and agitation. Sodium oxybate is the only major interaction, but melatonin has many moderate interactions with close to 200 drugs. Some of the moderate interactions include caffeine, immunosuppressants, and benzodiazepines. I could not list all the drugs that melatonin has interactions with, as there are many, but if you would ever like to take melatonin, be sure to check if any of the medications you may be taking will interact with it.
The nursing process.
When assessing a patient complaining of sleep problems, it is important to keep from oversimplifying a more serious case. Melatonin may work well for a patient who has no prior history of serious sleep issues and whose current sleeplessness isn't causing them tremendous inconvenience on a day-to-day basis. However, if a patient is complaining of specific problems, already has a diagnosis of insomnia, and/or has tried dietary supplements and over-the-counter medication and is still complaining of problems, it is time to recommend that they stop taking melatonin and call in a doctor to perhaps get a prescription. According to Neubauer 2019, a third of adults experience at least one symptom of insomnia, and when asked more broad questions about sleep problems, most patients reported that they were experiencing them. This is why direct questions are especially helpful in measuring a concern and steering an assessment in a more helpful direction.
Take melatonin only as directed and do not exceed recommended dosage. Talk to your healthcare provider about the right dosage for you, since melatonin is absorbed differently in everyone who takes it. Melatonin is categorized into the sedative category, so avoid taking any other medication or supplements that also have sedative properties to avoid interactions and minimize adverse effects. Refer to the drug interactions and adverse effects for a full list of what to avoid. Melatonin is not regulated by the FDA, so finding correct information online may be difficult, so always consult with your healthcare provider regarding any issues you experience.
Collaboration. When it comes to administering a new medication such as melatonin, it is important for the nurse to get a full background on the patient. This includes the patient's past medical history, including any drugs and medications that are being taken. It also includes any family history that would be essential to know when administering the melatonin. It's also important for the nurse to discuss with the provider proper dosing options as well as any other information regarding melatonin, so that the patient should be aware about. In terms of talking with the pharmacist, collaboration is necessary to ensure that the correct drug is being administered, in the correct form and the correct dosage. In some cases, the provider will suggest a specific brand of melatonin. In other cases, the generic brand will suffice. This is why collaboration with the nurse, provider, and pharmacist is essential. Teaching. It is important in the nursing process to teach the patient about taking melatonin. It is used to help patients fall asleep if they are having issues doing so themselves and should not be taken with alcohol. Doing so can make the patient dizzy, or if driving can cause extreme drowsiness. Also, it is advised not to take melatonin with other sedatives, as doing so can also cause extreme drowsiness. Any medication that you take while pregnant, the baby also receives, so it is advised to not take melatonin when pregnant to ensure of no adverse effects associated with it. If adverse reactions do occur, it is important to tell the healthcare provider so that they can suggest alternatives or make dosage changes.